or a life saved. I was diagnosed with kidney cancer at the age of 38, and from the point I received the diagnosis, I felt a Rolls-Royce machine kick into gear. I was treated by a world-leading surgeon, assisted by a robot, and of all the things going through my mind during that period, the one thing I never had to worry about was the bill. But I also saw an NHS that is struggling. Brilliant staff, but overworked, under-resourced, and burnt out. I saw how the NHS doesn't provide the level of at-home care that patients deserve. And the truth is, I was lucky. I went into hospital because I had a kidney stone. And if it wasn't for that, who knows how much longer it would have been before my cancer was discovered. And there are far too many people in this country who aren't as lucky as I was, whose conditions are not spotted until it's too late. Too many lives are needlessly lost because the NHS doesn't get there early enough. That is the change the NHS is crying out for. Early diagnosis, early intervention, and preventing ill health in the first place. And that is the change that a Labour government will bring about. And if we're serious about turning the NHS around from the worst crisis in its history to make it fit for the future, if we're serious about giving everyone the opportunity to live healthier, longer lives, it requires cross-government work. It requires partnership between the state, the private sector, and civil society. And that will only happen with strong leadership from the top. Today, Keir Starmer is setting out a hugely ambitious plan, not just to get the NHS back to where it was with the last Labour government, but to achieve things that have never before been possible. Compare that with Rishi Sunak's short-termism and lack of ambition for our country. A promise to cut waiting lists so unambitious that if next month waiting lists were to fall from 7.3 million to 7.2 million, we would no doubt see the Prime Minister rushing onto the airways to declare victory faster than Suella Braverman hurtling down a motorway. And that's just one of the many differences between the kind of Prime Minister that Keir Starmer will be and the abysmal leadership the Conservative Party has inflicted on Britain in recent years. Having spent his life dedicated to public service, fairness and justice, Keir knows better than anyone the number of lives that can be turned around and saved by a nurse, a GP, a teacher, a social worker, a care worker. The missions Keir is setting for the next Labour government are the priorities of the British people. And he will be a Prime Minister who pulls every lever available to achieve them and gets every department working together to build a healthier nation. And if you think that what Labour is promising today is too ambitious, if you think it cannot be done, I would gently remind you that you would have said the same thing in 2019 when Keir said that Labour could win the next general election. And since then, I have seen in Keir a leader who focuses relentlessly on the job at hand, who never gets distracted by the noises off, and is ambitious for Britain. So just as he has turned around the Labour Party from its worst defeat since 1935 to a party that is ready to serve the country once more, he will turn around the NHS from the biggest crisis in its history and make it fit for the future. So please give a warm welcome to the leader of the Labour Party, our next Prime Minister, Keir Starmer. And I didn't nick your notes off then either.
Thank you. Thank you, Wes. Thank you all for being here. It is fantastic to be in Braintree. I've got very fond memories of this part of the world because 16 happy years ago, I got married just down the road in the Fens. So that's why it's got this special place in my heart. And almost as good as that, this is where 2 weeks ago, at the local elections, the Labour Party was back on the march in Essex. But today I'm here to speak about something that's fundamental to the Labour Party, fundamental to our purpose of working people. The NHS. Just look at it. The 8 o'clock scramble, the appointments missed, opportunities missed, to spot the pain that turned out to be a tumour. Patients who want to go home are well enough to go home, but who have to stay in hospital for months, waiting for a care package. Day-long waits in A&E. Record numbers off work, sick. People pulling their own teeth out. 7 million on waiting lists. And ambulances for heart attacks and stroke victims that don't come on time. Just think about that for a second. Ambulances that don't come. Can any of you imagine losing someone in that way? I can't. And I mean that in every sense. I can't imagine it. It shouldn't be possible in our country, but it is. A cruel lottery of who lives and who dies that the NHS was founded to stop. And until now, until this point, for 75 years, it has. It's one of the greatest privileges of being born in Britain, certainly for all of my life. The knowledge that if you get ill, if you have a serious accident, you'll get the care that you need, whatever your circumstances. Not every country has a system like that, and the insecurity, the fear without it, is huge. Nye Bevan, the Labour Health Secretary who created the NHS, put it best. He said, "Illness is neither an indulgence for which people have to pay, nor an offence for which they should be penalised." That's what we believe, and it's under threat. I mean it. I don't think the NHS survives 5 more years of Tory government. And people say, oh, well, we've heard this before. The Labour Party is always saying it's time to save the NHS. But I say, look squarely in the eyes of the people who work in the NHS, who serve the NHS, and ask them. Speak to the working people who use the NHS, who depend on the NHS, who need the NHS. What do they say? And go to the people who believe in the NHS, love the NHS, but have been forced to buy the care they need from the private sector. Listen to them. No, at the next election, the NHS is on the line. The Conservative Party that's brought it to its knees will put it in the ground. But mark my words, if all we do in the Labour Party is to place the NHS on a pedestal and leave it there, that's not good enough either. We've got to fix the fundamentals, renew its purpose, make it fit for the future. Thank you. That's what this mission is about, a new direction for the NHS. To say to the British people, vote Labour, problem solved, would be an insult to everyone's intelligence. Patients can see how deep the problems go. My approach is different. It starts with the cause, the central project. How do we serve working people? And then it asks, what do we value? What do we conserve, cherish, and protect? The answer, a public and universal health system, free at the point of use, paid for by general taxation, the NHS. But then it asks, what do we need to change? What are the challenges, the opportunities? How can we save lives, improve lives, provide more dignity? Innovation, where can it be found? People, how do we unlock their purpose? Technology, how do we make it work for us? And when you've asked those searching questions, you turn back, you roll up your sleeves, or you face reality. And the reality is this. The NHS is not sustainable unless we make serious, deep, long-term changes. That's my politics. Reform for renewal, national missions for the common good, and NHS fit for the future. Now, some people will tell you it's purely a question of money, and money is a part of it. I don't deny that. Like any opposition, we will set out our plans before the election. And like any incoming government, we will make decisions based on a full appreciation of the reality, the state of our NHS and our public finances. But what's more important now, I really believe this, is to show our recipe for reform, to put forward a vision of a renewed NHS that can make the most of the money we invest in it. I've run a public service. I know that money makes a difference, but it only gets you so far. You can't look at the problems now and tell me it's just about money. That's not serious. You can't ignore the fact the world has changed. That's denying the evidence before our eyes. The British people are living longer. Life expectancy in 1948 was 68. Today it's over 81. That is a good thing, but it brings new challenges. The nature of disease is different. Instead of urgent and acute hospital care, now it's more about managing chronic long-term conditions. The wonder of science has taught us, with ever-increasing clarity, that our health depends on how we live. Mental health has stepped out of the shadows, and thank goodness. And with artificial intelligence, with personalised medicine, with new vaccines, we stand on the cusp of a revolution that could transform healthcare for the better. My message today is this: science and technology are the game changers. This is the prize. This is what it gives us. An NHS where prevention comes first, where care is closer to home, where patients have more control. So, to everyone working in the NHS today, serving on the front line, I say, thank you. Thank you. Without you, there would be no light at the end of the tunnel. But I also say, the walk towards that light will be hard, will feel challenging, difficult. But do not doubt it's essential, and that the reward for reform will be worth it. And look, don't doubt this either. The Tories will never deliver this. They voted against the NHS right at the start and more than once. And while they've come to accept it as part of the political furniture, in their heart of hearts, they don't believe in its central promise. For them, it's a cost, not a cause. And from that mindset springs the well of their neglect, the poverty of their ambition, the sticking plaster, crisis management impulse that never sees the opportunities, never addresses the long term. It's not that they don't care. It's that their priorities, their ideology, it takes them somewhere else. £200 billion a year. That doesn't square with their small state vision of Britain. And that's why we have familiar problems. Every year, for the last 13 years, we've had a winter crisis. And every year, in about February or March, we do just enough to keep the NHS going. We breathe a bit in the summer, and then we go into the next NHS crisis, the next winter. The only difference being it's worse than the one that went before. And you know what's even worse than that? The Tories underestimate the NHS. Underestimate the bond between people and service. Underestimate what you can do with a mission. That yes, people go to work in the NHS for a wage, of course they do, but also because they believe in something. This is how we go beyond the sticking plaster mindset, how we solve the crisis and tackle the long-term challenges. I want an NHS back on its feet. Of course I do. But I also want an NHS that's fit for the future. And that requires a partnership between people and service that builds on what is distinctive about the NHS as a health system. Now, protect the NHS was the pandemic slogan, and we did. And in turn, it protected us. So have no doubt, this mission is a cause, but it's a cause that can only succeed if we embrace the need for reform. So, Labour's national mission on health, to build an NHS fit for the future. And as with all our missions, we set the direction with clear, measurable goals. Goal 1, the next Labour government will deliver an NHS that is there when you need it. Ambulances, 7 minutes for cardiac arrest. A&E back to the 4-hour target. GPs, the highest satisfaction levels on record. Waiting lists down. Planned treatment within 18 weeks. No backsliding, no excuses. We will meet these standards again. We will get the NHS back on its feet. Goal 2, we will improve healthy life expectancy for all, and we'll halve the inequality gap between different regions of England. And let me explain what that means. It means we will restart a trend Britain has come to take for granted, that, to be blunt, we should take for granted. A sign of progress that generation after generation, the people of this country are living healthier lives, happier lives, and longer lives. The Tories have reversed that. That's their legacy. And look, by focusing on health inequalities, we can make Britain fairer as well. Did you know black women are 4 times more likely to die whilst having a baby than white women? In my constituency, a girl born in Highgate Hill will live 10 years longer than a girl born in Somerstown. That is 3 miles away. My Labour Party won't stand by and let that happen. We've got to root these inequalities out. And to achieve this, we must zone in on our biggest killers. 3 killers which we know are demanding questions of our healthcare system. 1, cardiovascular diseases, heart attacks and strokes. We'll get them down by a quarter within a decade. 2, cancer. We will make sure 75% of all cancer is diagnosed at stage 1 or 2. Let me tell you what that means, the difference it will make. The survival rate for cancer at stage 1 and 2 is 81%. But at stage 3 and 4, it's just 26%. What a difference that would make. And finally, killer 3, suicide. Last year, I went to an event organised by the band New Order, and they asked me, for obvious reasons given their history, did I know anyone that's died in that way? I have to admit it took me aback. I've never been asked that, certainly not in public before. But you know, I didn't have to think that long. I do. More than one, in fact. 3 friends. And if I asked everyone in this room the same question, I guess you wouldn't have to think about it for long either. Suicide is the biggest killer of young lives in this country. The biggest killer. That statistic should haunt us. And the rate is going up. Our mission must be and will be to get it down. So there's no time to dither. This mission starts with people. That's at the height of the crisis right now. That's why we've committed to the biggest expansion of NHS training in its history. More nurses, doctors, midwives and health visitors, all fully funded by removing the non-dom tax status. It's why we'll leave no stone unturned when it comes to finding new ways to cut waiting lists. Labour has done it before and will do it again. Imagine that you're waiting for a knee operation. and the waiting list isn't going down at your local hospital. But in the trust next door, they have a specialist orthopaedic centre and things are moving much more quickly. I say you should be able to go there instead. I say there shouldn't be a separate waiting list at this hospital, a separate waiting list at that hospital. Hospitals should work together. So I can announce today, to cut waiting lists more quickly, patients should be able to visit nearby hospitals when faster treatment is available, and Labour will give them that choice. And that's only the beginning. As I keep saying, we've got to go beyond the sticking plaster approach. I talked earlier about the light at the end of the tunnel, the reward for reform. We've got to hold on to that. And there are grounds to be optimistic. But it will require 3 shifts, shifts which must place at the heart of everything we do on health. Shift 1. We must move care away from hospitals and closer to the community. The NHS must become a neighbourhood health service. I'll put it bluntly, at the moment, we aren't good enough at treating people early in the community. We leave it to hospitals, and quite often, that's too late. And if we change this, it will save lives and money. That's why we're going to improve GP access, end the 8 a.m. scramble. We'll train more GPs, but we'll also make the future of general practice more sustainable. As the contractor model declines in some communities, we won't let patients go without the care that they need. So we'll bring fragmented services together and make sure salaried GPs serve all communities. And we'll modernise the appointment system. For those who want real continuity of care, we'll bring back the family doctor. That's what people with long-term conditions need. But for those who just want a quick appointment at their convenience, who want a digital consultation, we'll give those patients a different route. Seriously, it can't be beyond us to offer different options for different people. We've just got to roll up our sleeves and get it done. And one more thing. We've got to fix the backdoor problem. We can't have hospitals blocked up by patients who are desperate to go home and ready to be discharged. So we'll make good on the integration of health and social care, backing successful models like the Centre at Bromley by Bow, where in one place they bring together doctors, nurses, physiotherapists, social carers to provide joined-up care in the community, keeping people out of hospital. And look, we will recruit and retain more carers with a fair pay agreement. This is fundamental. It's about who and what we respect. It's about better standards at work, about dignity, more progression, more training, more rights, and yes, about pay. A fair deal for our carers. That's what people clapped for. Shift 2, we must move from a mindset that views health as all about sickness to one where we put prevention first, right across society. So we'll take bold action where early intervention can make a huge difference on mental health. And make no mistake, we intend to revolutionise mental health treatment in this country. 8,500 new mental health professionals, specialist access in every school, guaranteed treatment inside 4 weeks for anyone who needs it. And look, the mission we're launching today isn't just an NHS mission, it's a health mission. When we talk about a new deal for working people on employment rights, about good work for all, that's a health policy. When we say we'll provide breakfast clubs with healthy food for all primary school children, that's a health policy. When we commit to restoring a decent home standard, to regulating the water industry, to a new Clean Air Act. They're all health policies. And when I say we will take on the social media companies who push dangerous misogyny on our children, I am saying very clearly to those who profit from harming our children, no, not in Britain. And today we go further on that. We will change advertising rules, and we will make sure that products which are harmful to our children's health, vaping, junk food, sugary snacks, cannot be advertised to our children. No, not in Britain. Shift 3, technology. A revolution that will accelerate the first 2 shifts and herald a different kind of healthcare. A move from an analogue to a digital NHS, a tomorrow service, not just a today service. And mark my words, this can be transformational. The route to the NHS offering shorter waiting times, better treatment, early diagnosis, and meaningful prevention. Britain leads the world in science and technology. We can make this happen. This is the game changer, the light at the end of the tunnel. This is what will make the NHS fit for the future. I'll give an example. 33 million people downloaded the NHS app during the pandemic, and it's a good app. But that extraordinary opportunity, it's been wasted. Labour would take the app and innovations like it. We would deepen them, expand them, and put them in the hands of patients, and use them to transform our relationship with the NHS. Get this right, and it means moving to a fully digital patient records. Never again handwritten notes getting lost. It means booked appointments, appropriate self-referral routes, reminders to get checkups and screening, the latest guidance on treatment, patients in control of their own data, choosing how it's used and how it's shared. This will get rid of a divide between those confident to speak up for themselves and those who can't. And look, if we make sure everyone is supported, then we can take people on this journey, and it will mean people can get better choices, will get faster care, can manage their own health. In truth, it's about politicians catching up with the public and the NHS catching up with the revolution that's already happened in the rest of our lives. And it doesn't stop there. Technology provides more choice and power for patients, but it also saves lives. Take artificial intelligence. AI will change the nature of healthcare, and Britain is good at AI. I'll give an example. Lung cancer is the #1 cause of cancer-related deaths in the UK. 274,000 patients waiting for 11 days or more to hear back from the scan, which could tell them if they have cancer. AI can reduce workload and raise productivity. But here's the real thing. When used properly by a radiologist, it can reduce missed lung cancer diagnosis by 60%. And because it's quicker, because it's more accurate, the lives it could save through early diagnosis are countless. But to make this happen, innovators need one route into the NHS, not many, incentives to innovate throughout the system, fewer barriers to adoption, fewer hurdles to clear, less bureaucracy, more clinical trials, and a government that uses its full power to back our world-leading life sciences. And look, when you add this all together, the sum total of these 3 shifts, what you get is a plan for a future NHS that protects what is precious and embraces what is possible. From everyone waiting, stuck on the call at 8 a.m, to a primary care system that offers different choices for different needs. From long waits at A&E to hospitals that carry a lighter load because more care is in the community. An NHS where technology gives patients more responsibility and professionals more time, where we diagnose disease earlier, screen people in supermarkets, libraries, leisure centres, communities, where we can save lives because healthcare is closer to lives. And above all, where the whole of society contributes to the mission of healthier, happier, longer lives. That's an ambition we can rally around, a goal that can lift the anxiety, the pain, the fear faced by millions of families across the country and replace it with the hope of a renewed NHS. In place of fear, that's what Nye Bevan called his book. And if people want to call me dewy-eyed, want to say I'm a romantic about the values of the NHS, I plead guilty. The NHS has played an enormous role in my life. My mum was a nurse, a proud nurse too, but she was also severely ill for most of her life with a rare condition called Still's disease. At the age of 11, she was told two things. One, she would be in a wheelchair by her 20s. Two, that she should forget about having kids. Now, that diagnosis didn't reckon with my mum's determination and courage, but it also didn't reckon with the NHS. A doctor at Guy's Hospital in London refused to give up. He found an experimental treatment for this 11-year-old girl, and the rest, as they say, is history. Honestly, lots of people say they owe the NHS everything, and I'm definitely one of them. But that's just the point. Mum's story isn't special. Behind every single door in this country, there is a family who will have their own version. This is who we are. The NHS belongs to everyone. The foundation for the comfort, security, health of working people. For 75 years, and ever present in our story, family and nation. My message today is simple. With Labour, the story continues. We have a plan. I want the patients of the future to remember this moment, remember the changes we'll make together. That's our mission. We will fight for the NHS. We will fix the NHS. We will reform the NHS. Old values, new opportunities. Technology and science, convenience and control, renewal not decline. An NHS not just off its knees, but running confidently towards the future. Thank you very much. Thank you. Thank you. Thank you. Thank you very much. Thank you. Thank you. Thank you very much. We're going to take some questions, starting with the media. My list tells me that Helen Capp from the BBC is first. Helen.
You've set out some wide-ranging reforms, but you have said that money does play a part. Would you expect under Labour that overall more money would be going into the NHS?
Well, look, money is important, but it's not all about money. And what I'm setting out today is that change and reform plays a hugely important part. And what I said about technology is an important part of that. Technology can be the revolution. Technology can do what money can't do. So I accept that money is part of the solution, but change and reform is hugely important. The game changer is technology, is about what we can do in the future that we can't do now. And that is why this mission is not just about getting the NHS up, I say off its knees, my wife says on its face, and getting it standing up again, but actually creating an NHS that's fit for the future, and that means harnessing that technology and that change. Thank you very much, Helen. Let me find my list. I've got Liz. Liz. Hi, Liz.
Hello, Liz from Sky News. Just to follow up on that, it does seem like you're trying to sort of kick this issue of money into the long grass a little bit. How do you expect the public to trust you with the public finances if you're not prepared to say quite straightforwardly, these are our plans, this is how much they will cost, and this is how we will pay for them? And if you don't mind, just very quickly, on strikes and striking workers, some of them will be watching this speech thinking, oh, you're going to bring loads of new staff into the NHS, but you won't say how much you're going to pay them, and you won't stand with them on the picket lines. These are the people that you want to deliver your plans. Do you have anything new to say to them today?
Well, Liz, look, first of all, let's just call a spade a spade. Where we've made a proposal about the change we're going to bring, we've said how it's going to be funded. So this challenge you put to me that we've not said where the money is coming from is just wrong. Actually, are we going to have the biggest increase in training for the NHS that it's ever had in its history? Yes. Are we going to pay for that by abolishing the non-dom tax status? Yes. Are we going to have 8,500 more mental health advisors in our communities? Yes. Are we going to pay for it by closing the tax loophole for private equity? Yes. So what we've been careful to do is to say where we're making changes, what the change will be and how we will pay for it. But we have to, I think, see that the change that can be brought around through technology and digital working, data AI, is going to be transformational. Of course I know that we've got to put more money in and we've got to grow the economy. But, you know, what we're putting on the table is the change that the NHS needs for the future. And as for the staff, look, I know the NHS staff pretty well. My wife is one of them. So I get a daily readout of what is uppermost in their minds. They want to know they're fully supported. They want to know they're respected. They want to know there's a plan for the future, because the one thing that I've been struck by recently is the number of people who are not just worrying about appointments, about waiting lists, about A&E under this government, 13 years of failure, but now worried about whether the NHS will continue to exist. We've not been in that place before, and the staff share that. And when we say to them, we're going to have the biggest training regime the NHS has ever had, that the cavalry is coming, that is very, very welcome to the staff who desperately, desperately need it. Thank you, Liz. Shihab from ITV.
Shihab Khan, ITV News. You talk about all these reforms, you talk about new technology that you want to see introduced into the NHS, but all of that will cost money. Is there an estimate of how much exactly this is going to cost and how quickly can you implement it? And a second question, if I may. You've spoken about NHS staff. We know that morale is particularly low at the moment. There are many who feel they're overworked and underpaid. How do you bring them along with you on this process of reform and change if you're not going to pay them more?
Look, on cost, we have set out the costing for our specific proposals in terms, what it will cost, where we will get the money from. Technology, research, development, they will be the game changers of the future and reduce cost. If we go to a preventative model, it will make a huge difference. Take cancer diagnosis. It's not just obviously better for patients to be diagnosed earlier, because you heard the statistics about survival rates. It's also a reduction of cost across the NHS. Merging waiting lists so that you don't have to just wait for one hospital, you go to different hospitals, will reduce the cost. So, you know, I do understand the challenge that you are all putting to me, but I have run a public service. I do know the stresses and strains of public service, but I also know, having run a public service for 5 years, that it's not all about cost, that change and reform is critically important. And you know, if we just put more money in the top of our public services, we will get a better outcome, but we won't get a materially better outcome unless we change and reform. That was my lesson from running a public service for 5 years. Thank you, Shihab. Chloe from the Eye. Chloe.
Thanks, Keir. You've announced plans for what you describe as an ambitious reform of healthcare, but there's been little to no detail about what you would do about social care. Is that no longer a priority? And if it is, when are we going to hear about these plans?
Yeah, look, it is a priority because I think everybody understands that the back door to the NHS hospital crisis is getting people out of care into the community, and that social care is a big part of that answer. What we have set out on social care in clear terms is a plan for the staff, for those who work in the care sector, declare an interest. My sister is a care worker, so I know the sector pretty well. There are over 100,000 vacancies, and we have to fix that problem. And I think the only way we can fix that problem is by having a framework for staff within social care, so that they have fair pay agreements, so they have dignity and respect, so they can progress through on a clear careers path, which isn't there at the moment. I think it's 1 in 3 people leaving social care are going into the NHS, and they're doing that because there's a better chance of progression than there is in social care. We've got to fix that. I think we can look at the roles that social care workers can do, the sorts of tasks that they can do. All of that is a big part of what we need to do on social care. And we also, I think, need to have as a clear principle a sort of home first principle, so that it starts with what can be supported at home rather than simply assuming that that can't be provided and we've got to go elsewhere. Thank you, Chloe. Sam from the Sun.
Thanks. Would you do anything to reform the way that you decide how NHS staff are paid? The Royal College of Nursing are still not happy with their pay offer, so what would you do about that going forward? And would you give a pay rise to consultants earning 6-figure salaries?
Look, on the structure of negotiations, we haven't focused on that, to be frank, because what I've set out today is what we need to do to make sure the NHS is fit for the future. So we know that a fair pay agreement, fair pay is an essential part of that. And I think it was Saturday just gone, this government has lasted as long as the last Labour government. And that gives us a really good opportunity to compare and contrast. Because under the last Labour government, nurses were paid fairly, there wasn't a national strike, waiting lists were down, and satisfaction in the NHS was at a record high. Compare that with what we've got now, where nobody really quarrels with the proposition that after 13 years of failure, the NHS is on its knees. The only debate we're having is it on its knees or is it on its face? That is a shocking, shocking legacy. Thank you, Sam. Aubrey from The Guardian.
Hello, Aubrey
Hi,
Allegretti
Aubrey.
from The Guardian. So, Keir, one of the main targets that you've set out this morning is to reduce deaths from heart disease by a quarter in 10 years. This morning on the radio, you were asked directly and said you wouldn't support levying a salt or sugar tax during the cost of living crisis. But when food prices return to normal levels, do you rule it out full stop?
Aubrey, the focus that we put today is very clearly on advertising. This is something the government toyed with and then moved away from. I think that showed a fundamental weakness in their approach and unseriousness about tackling the issues that really matter. What I don't want to do in a cost of living crisis is to add to the burden of food cost for families that are struggling. So that's why I've been very clear about where the focus is today, why we're focusing on advertising. And this can be done very simply and very easily and will make a material difference to predominantly the children and young people involved into their health, but also have a significant effect on the NHS itself. Nick, I think the Health Service Journal. Nick.
Hi, Nick Katuna from the Health Service Journal. You've set out the plans for improving performance in the NHS, but under Blair, one of the key tenets of that was strong NHS management. In terms of where you go forward from here, do you think that we need more managers just as much as we need doctors and nurses to get the NHS back to where it is? And a very quick second question, the capital programme set up by the government, do you plan to carry that on, the new hospitals programme under Labour? Thank you.
Thank you very much. On the question of the staff, the workforce of the NHS, my message is clear. First, thank you. You are the light at the end of the tunnel, and we wouldn't have it without you. Secondly, there's got to be change, and everybody will have to step up. So I don't think it's a question of distinguishing. I actually think that most of the reforms that we want to carry out will be frontline. It'll be at that prevention stage, the diagnosis stage. And so it'll be very frontline led, but you know, everybody across the NHS, in order to sustain the NHS, will have to be part of that change and reform. On new hospitals, look, I mean, it's hard to say we'll continue a plan which isn't really a plan, because these 40 hospitals are pretty mythical. But look, I don't dispute that you know, infrastructure and structures are hugely important in all of this. Everybody everywhere will have a story of hospitals that you know, have all sorts of difficulties because they've not been properly maintained. And of course, we will inherit that, and we will have to deal with that. I do think our argument that the burden on hospitals should be lightened with more care in the community is hugely important to this, because you know, at the moment there's rarely a stepping stone between the local GP and going to a hospital. And we have to close that gap. So yes, it's a problem we will inherit. No, I don't think the government's got a real plan. It was another thing that was said, but will not be done. We will inherit that, of course, but our plan goes beyond that question into the way care will be provided under a future model, to make the NHS not something that we just reflect on with pride, but actually is there for the next 75 years in the way it's been there for the last 75. Thank you, Nick. I've got Sophie from the Mirror.
Hi.
Sophie.
Sophie Huskisson from the Mirror. So you mentioned in your speech about black women being 4 times more likely to die during childbirth. And we obviously see these health inequalities across the board with staff too, with minority ethnic doctors being less likely to get specialist NHS training. Would you say that the health service is institutionally racist? You also say that you'll root out these inequalities, but can you say actually how you'll do that?
Yeah, look, I'm not here to denigrate the health service, and actually my point was really to highlight the inequalities. And I think that statistic about black women dying you know, when having a baby is very arresting. And I think nobody can listen to that and not have instilled in them a real sense that things have got to change. So wherever it is, it's got to change. But inequality is a big part of the health challenge. And I don't think it's possible to solve the health challenge if we don't tackle at the same time the inequality challenge. So thank you very much, Sophie. Nick from the Telegraph. Nick.
Yeah, thank you. To come back to the money, if I may, you've said the NHS is underfunded and that you are going to put more money in. Health spending as a proportion of government spending has risen very rapidly over the last couple of decades. It's now at about 22%, and that has obviously come by spending less proportionally in other areas. Do you think that number's too low, and how high would you be prepared to see that go? 25%, 30%? And on the same theme, you know, you've made sort of great play of balancing the books. So when you do come up with proposals in the future for how you're going to pay with all this, will you be straight that it's going to be either tax rises or spending cuts in other areas?
Nick, firstly, on the money that's already going into the NHS, it needs to be used as effectively and efficiently as we can. And among my frustrations with the annual NHS winter crisis is that the sticking plaster, the bit that comes in January, February, comes with a huge price, usually too late to make it as effective as it could be. And therefore, simply using the money that's going in more effectively will make a huge difference. There are plenty of other examples when it comes to early diagnosis, screening, preventative measures, etc. On your challenge as will we set out in terms what we will spend and where we'll get the money from, then yes. As you will have seen, there's a pattern here under Labour, which is where we say we're going to do something, we set out what it's going to do, and then we say where the money will come from. We will continue in that vein. But I can't emphasise enough that simply believing that everything is about money and not about change and reform, I think is to look at this in the wrong way. I think that change and reform, technology, AI, these are going to transform healthcare in the future and reduce the cost along the way. And we've got to approach the next 75 years, the next generation of healthcare, with that very firmly in mind. Thank you, Nick. I've got Russell from Anglia. Russell.
Hi there. Yeah, I appreciate you've touched on infrastructure a little there, but you've come here to the East of England to outline your plans and your vision for the NHS. The East of England has many NHS buildings which have reached the end of their life, including the hospital in King's Lynn, where there are 3,000 props holding up the roof. We've got crumbling roofs at the West Suffolk Hospital in Bury St Edmunds. It is your ambition to keep people out of hospital, but many will still end up there. How much have you factored in the cost of renewing the NHS estate in your plans, and will that involve public-private finance initiatives, or are you trying to avoid locking hospitals into those?
Russell, firstly, let me acknowledge the premise of your question, which is that the East of England has real challenges when it comes to hospitals. Also, I think in terms of GP accessibility in some parts of the East of England. So there's a real challenge here. And yes, of course, we've got to deal with the infrastructure. The state of our hospitals is unacceptable in the East of England or anywhere across England. So we will have to deal with that. My speech, our plans today are or include the future of healthcare generally. So, will we have to deal with the terrible legacy that we will inherit if we're privileged enough to come into power? Yes, we will. Will we have to fix the problems? Yes, we will. I don't shy away from that. But if all we aspire to do as an incoming Labour government is to fix the problems and put the NHS back where it was before 13 years of failure, then I don't think that's ambitious enough, which is why we've gone way beyond that today. Thank you, Russell. And I think we've got Ben from BBC Look East.
Yeah, Ben Scovey from the BBC in the East. Changing tack slightly, you said you came to Braintree because Labour was on the march in Essex, but in Harlow the party went backwards. Elsewhere in our region, you had been bullish about taking Great Yarmouth Council, but failed to do that. And local authorities, the Greens are now the biggest local party. Why do you think Labour underperformed at the local elections earlier this month, and how much responsibility do you take for that?
Well, Ben, thank you very much for that challenge. I think you put a version of that challenge to me last year after local elections as well, and quite right too. What I would say is this. 3 years and a couple of months ago, I took over as leader of the Labour Party, and as Wes was saying in his introductory remarks, that was a Labour Party that just lost an election, the worst loss we'd had since 1935. Many people thought it was impossible to go from there to even talking about a Labour majority government. Now, the challenge I'm getting is, how are you going to actually set up that Labour majority government? What are you going to do in government? I'm pleased to take that. We did make progress here in the East of England. We did make progress in the places you mentioned, but we've got to do more. And I've said to my shadow cabinet, we've got to step up again. The trajectory we're on is a trajectory that takes us to a majority Labour government. And I'm very pleased about that. And that's not just about numbers. If you look, we're talking today about the NHS, but if you look across the country, the sort of overwhelming conclusion pretty well now is almost everything is broken and nobody feels better off now than they did 13 years ago. That is the scale of the challenge, and we need a majority Labour government to get there. That means we've got to earn every vote, including in the East of England, including in the places that you mentioned. And I'm determined that we will continue to do that. But the progression in the Labour Party from where we started to where we are has been very, very significant. And most people, when I took over as leader of the Labour Party, shook me by the hand and said, good luck. And then in the next breath said, it's not possible to get from where you are to a Labour government in one parliamentary term. I've never accepted that. I don't accept it now. And we will march, to go back to my opening words, on here in Braintree and the East of England, as we will across the whole of the United Kingdom. Thank you all very much indeed. Thank you. Thank you.